Hello everyone and welcome to today's Australasian Lymphology Association webinar. Today's discussion is yoga and lower limb lymphedema. We are pleased to welcome our presenters for today, Annette Loudon. This webinar is live and interactive. You are encouraged to participate by posting questions to the presenter, which can be typed in the chat box located at the bottom left-hand side of your screen. All questions will be answered throughout and at the end of the presentation. If you are experiencing difficulty hearing the sound during the webinar, please dial the 1-800 support number listed in the chat box. I'd now like to pass you over to Heather.
Thank you, Shona. Annette has lived a peripatetic life exploring and working in Central Australia and remote parts of our continent. She's had a lifetime of thoughtful involvement in yoga practice and in translating the knowledge acquired first from observation, but then through working in multidisciplinary teams and through her own scientific research into classes for her students with lymphedema. From the very first moment that I met Annette, which was when she came to Tasmania to begin her Masters by Research into lymphedema, I was impressed with what a totally warm, considered and giving human being she is. Some of you will already know her from her presentation on research into yoga for secondary lymphedema of the arm that she gave at the ALA conference in Cairns. And some of you will know her from the DVD on the same topic that she generously self-funded and which she gave to the ALA for distribution. She is passionate to educate and bring her therapeutic yoga program to as wide an audience as possible. So without further ado, I'd like to hand over to eminently qualified Annette to further enlighten you on yoga for lower limb lymphedema. Thanks, Annette.
Thank you, Heather, for such a warm and considerate introduction. As Heather said, I left Sydney and closed my business about 9 years ago. And I put little smiley faces in some of the rural and remote areas that we've been living in that time. And we're now at a little place called Quedgenup. And if you don't know where Quedgenup is, it's halfway between Kawarramup and Quindalup in southwest Western Australia. But interestingly, it's been in the last 5 years that people with lower limb lymphedema have been coming to me either from after I've spoken at consumer groups or through emails or in some of the yoga sessions I've conducted in these areas. And I'd just like to read an email I got. I train yoga teachers in yoga for breast cancer and lymphedema, and one of my yoga teachers lives in the Eyre Peninsula. And when we got onto the lymphedema section, she started doing some of the routines I had for lower limb lymphedema that have helped change her life. She lives on a property and is quite remote. And she wrote to me with these words saying, yoga has given me the tools to manage the lymphedema I live with to a much greater level. The breathing techniques have given me a method to discreetly and effectively manage the lymphedema while I'm at work. She's a nurse, a rural nurse. While I am driving or flying at any time I need to. And she further said, knowledge is power, and the more I learn about how to manage the lymphedema myself, the more empowered I feel. I don't have to just put up with it. Now, interestingly, and she is really typical, her legs swole about 7 years ago during chemotherapy for breast cancer treatment. And when she first contacted me, I said, have you actually been diagnosed with lymphedema? And my concern was she may have had primary lymphedema, but she told me she was adopted, so she couldn't really find out about that. Anyway, a couple of weeks ago, she went to the lymphedema clinic in Adelaide specifically to get a proper diagnosis. And you'll see at the end that she was actually diagnosed with lipedema, which has changed her life. She's since been in contact with the Lymphoedema Association. And this is why the lower limb lymphatic yoga have been helping her. And I'm sure you've all found this too, that In rural and remote areas, people don't even know about lymphedema, or they can self-diagnose, and until they've got a really correct diagnosis, you know, they're not getting treatment. Often it's me sending people to lymphedema therapists or physiotherapists. So today I'd like to talk about the research in yoga and lymphedema generally, in lower limb lymphedema and yoga and lower limb lymphedema. And because I'm first and foremost a practitioner, the considerations and the practices that need to occur. So I've tried to put some of these places in my slides. This is a temperate rainforest in southwest Tasmania. So even in 2004, lymphedema therapists, Burness and Witter, actually researchers, academics, said because there is no ideal clinical answer, we need to be open to new ideas and creative, low-cost, low-maintenance approaches, while at the same time demanding evidence of efficacy and assurance of safety and protection for our patients. They went on to say, in this light, alternative complementary therapies may in the future be important adjuncts. And as recently as 2014, another lot of lymphedema researchers said this: they know, and we know, that intensive phase decreases lymphedema volume and heaviness, limiting limb function. But with lower limb lymphedema, they stated the benefit is partially abolished after the first 6 months of maintenance. And they also concluded there's a need to consider how to provide optimal care for long-term control of lymphedema in other and novel ways. So when we look at complementary therapies at the demographic, we know that it's middle-aged women with higher education, and there's higher usage for those with chronic diseases, including cancer. Women having breast cancer treatment are high users, and I've certainly found this. They started coming to me in Sydney in the 90s with both after and during breast cancer treatment and with breast cancer-related lymphedema and ovarian cancer. And this complementary therapies includes body-mind therapies, meditation, and yoga. And it's been really interesting to me what the cancer organisations say. When I started in this field in the mid-90s in Sydney, the cancer organisations were aghast at people coming to yoga. But they've really changed due to evidence base in this time. So organisations such as BCNA and Breast Cancer Org in USA say that complementary therapies can improve physical and emotional well-being, relieve symptoms, ease treatment side effects such as pain and fatigue, and improve quality of life. Cancer Australia stipulates that it must be evidence-based with scientific evaluation, and Cancer Council Australia and Bowel Cancer Australia say it may improve sleep, decrease stress, and enhance quality of life. Clinical research, they say, shows that breathing may reduce pain, but they say that you need to ask your doctor if you can do yoga, exercise, and Tai Chi, plus get the qualifications of practitioners. And I agree totally with all of those statements. Now, as far as people with lymphedema go and yoga, we know from Finane et al. Study that women are attending yoga, and the people who responded to that survey, 75% had breast cancer, and the others were gynecological secondary lymphedema. And we know from Deirdre et al. That people, and these were all breast cancer-related lymphedema, want to know more about the effects of complementary therapies on lymphedema. Now, most of the evidence base with yoga is on breast cancer-related lymphedema, which I'll summarise. So I did send some pre-reading, and I believe you may have only received that yesterday. I did send the rationale of yoga and breast cancer-related lymphedema, published in 2012, because the principles are similar, not exactly the same, lower limb lymphedema. My team also published the method of our randomised controlled trial, which was 8 weeks of a 1.5-hour class and 45 minutes of a daily home practice on DVD, where we randomised 28 women in Hobart and Launceston in Tasmania. Now, the first results of lymphedema, quality of life and tissue density were published in 2014, where we stated that compared to the control group, the quality of life of symptoms decreased, and interestingly for me, tissue density decreased in the upper arm. I actually thought it would in the chest and upper back. Our second lot of results were published last year for the range of motion of the shoulder and spine and strength of the shoulder, and in those published results we show that pelvic stability improved and the strength measure of abduction in both shoulders improved compared in the yoga group compared to the control group. Under review at the moment, we've got our qualitative studies and the actual method of yoga used. Now, there's been some other studies. I really like this one that Jan Douglas and her team published in 2012. She did a 4-week randomised controlled trial, the results of which haven't been published. But this study compared 6 months after that trial, 9 women who continued with yoga just once a week, either in a class or continuing doing the CD they were given for the trial, compared to those 9 women who didn't. And they found there were no significant differences, but the quality of life was maintained for those who continued with the yoga compared to those who didn't. And there was a trend to lower volume of arm lymphedema and overall tissue density. Now, I like this because this is more realistic. This is what people do, isn't it? Come to yoga maybe once a week. Another 8-week, but a non-randomised controlled trial of 6 women where they went to a class 3 times a week and did a home practice resulted in lower arm volume, but no change in quality of life or hand grip. Now, within my study, within the intervention group, they also had lowered arm volume. And I didn't get a change in hand grip either, which is interesting. And last year, the team in Kerala published a 3-month non-randomised controlled trial where their 8 participants had Ayurveda, dermatology, they did a home practice and Indian manual lymphatic drainage and got counselling and education. And they put forward a possible protocol for yoga and breast cancer-related lymphedema. And they didn't show the actual results, but they also said the arm volume reduced. Importantly for me, there's also been a good practical evidence base. So this is one of the groups in Canada, a woman with a yoga teacher actually with breast cancer related lymphedema contacted me when I was doing my research in Hobart, and she's done my online courses, and for the last couple of years she's actually been teaching at a cancer centre 8-week classes, and this is one of those groups in Toronto, and they use the DVD from ALA and they actually listen to the relaxation with my Australian voice, which funnily enough they say is relaxing. My son thinks that's hilarious. And she also now works with a lymphedema therapist and they offer yoga, which is really exciting. So there's also a qualitative study which had 13 women. It was non-randomised for 18 weeks for women who had arm morbidity after breast cancer treatment, and they just state some of those women had lymphedema. And the themes that emerged from them were embodiment, improvement in posture, and an increased awareness of their own arm morbidity. As I said, my qualitative results are under review at the moment. Excitingly, Sheila Ridner's team in America has been looking at yoga for head and neck lymphedema, where the participants get 3 sessions a week for a month. And their results aren't published yet, but I'm really looking forward to reading them. So what are the commonalities of all these studies? There's improvements or trends to improvements. There's been no adverse effects. They're all based on lymphatic clearing, but in slightly different ways, I have to say, and all had close monitoring of lymphedema. Now, last year, Singh et al. Published a paper concluding that exercise, which did include my study and Fisher's study, is safe, but they did state that 19 out of 20 of them were based on breast cancer-related lymphedema. Only one was on lower limb lymphedema. And like all of us, they pleaded for more research for lower limb lymphedema. And I'm sure as therapists, you all know this. This is the Western Australian flowers last September. So what are the considerations that we need to make? Well, we know lower limb lymphedema can be primary or secondary from a whole lot of causes. And since I attended the May Darwin conference last year, I'm now including lymphedema in all my training. But what I'm going to talk about in the practical part of what I do, to confine it a little, is what I've given people with primary lower limb lymphedema and secondary from various cancer treatments, trauma and infections. I have worked with the others, but I'm not going to talk to them because talk about them today. And I am also going to mention the work being done in Kerala for yoga and lower limb lymphedema from filariasis. Now, getting the incidences is really difficult for lower limb lymphedema. So Ryan et al. Stated it's between 10 and 40% for gynecologic cancers and melanoma, while Brown et al. Stated 24% for cervical and 36 to 47 for uterine and vulval cancer. I can't find figures for bowel and rectal. I don't know if any of you have them. I'd love to get them if you have. And we know from the ALA site, primary lymphedema is 1 in 6,000. Now, what are the characteristics? An online survey of people with upper and lower extremity lymphedema, the result concluded that there were more frequent and more severe symptoms for those with lower extremity lymphedema. There were more infection episodes, and these are all significant results, and more infection-related hospitalizations. And interestingly, and I found the same thing, I'm sure you have too, there were no significant differences of symptom burden and infection status between individuals with lower extremity primary and secondary lymphedema. Now, another study with a whole lot of these cancers that included removal of lymph nodes or radiation of the abdomen or groin resulted in 107 respondents, 37 of whom reported one symptom of lymphedema. Now, 78% of the whole respondents had never heard of lower limb lymphedema, and this echoes what I'm finding. Of the 35% who had one or more symptoms, 100% said they had difficulty walking, 86% said they had achiness, 76% puffiness, 73% pain on one side of the body since cancer treatment. 81% had more than 3 symptoms, and those with more than 3 symptoms were greater than 65. Now, those symptoms are what I've noted with people who come to me, but I have to say mine are usually in the younger age group. As far back as 2000, it was being reported that for those with lower limb lymphedema, they had difficulties walking, standing, and lifting heavy objects. And more recently, those with lower limb lymphedema had less physical activity than those without. So the characteristics, the unique characteristics, we know the leg is bigger than the arm and has different hemodynamics. We often see bilateral leg lymphedema. People are often older, but that hasn't been the situation with me. The age group I get are maybe between 30 and 60. There can be a problem with diagnosis, as we saw earlier with my online student self-diagnosing, and she actually had lymphedema. It just blew up when she had chemo. And often the treatment, and I've found this, as I'm sure you have, is slower to start. So there's not a lot of good studies for exercise and lower limb lymphedema. Excitingly, one was published last year for aqua exercise with 32 limbs of 16 people, 14 of whom had venous edema, and the other 2 had bilateral leg lymphedema from cancer treatment. So they had 5 lots of sessions, 2 times a week, 50 minutes each in a pool. At the end of that study, they had reduced lymph volume and increased ankle range of motion and reduction in feeling of heaviness. They were often horizontal in that study. It's a nice study to read if you're interested in doing, ankle kind of and whole leg movement. And the resistance feasibility study of lower limb lymphedema from different cancers of 10 people for 5 months of resistance training twice a week showed significant improvements in bench press, time to walk 50 feet and distance in 5 minutes. And the authors noticed that the distance walked was 30% lower still than the general population. But interestingly, the authors concluded there were 2 cases of cellulitis diagnosed among the 10 participants. And they concluded that exercise prescription for this population should proceed with caution. Now, what about quality of life? This is an Australian study, and I find it really interesting. So compared to women without lower limb lymphedema or without lower limb swelling, those with lower limb lymphedema had lower physical quality of life, but those with lower limb swelling who hadn't been diagnosed with lymphedema or getting treatment had significantly lower mental and physical quality of life. And so the authors here concluded that early diagnosis may improve mental quality of life. And when I read quite a few of the case studies written by lymphedema therapists working one-on-one with people who had had slow diagnosis of their lower limb lymphedema, once they'd been diagnosed, their improvement was really great. And I'm sure as practitioners you would agree with that. So we know the optimum treatment for lower limb lymphedema is complex lymphedema therapy and self-management. So yoga is an adjunct to the self-management. That's where it comes in. Now, I come from a very cautious basis, the safety. I'm a yoga therapist. I've always worked with ill people. I trained in the early 90s in England, particularly to work with ill people. And because in the 90s, when people with breast cancer-related lymphedema started coming to me, and exercise then wasn't even encouraged, I've always erred on the side of safety. So I was interested, and I always tell my own yoga teachers that I'm training this quote from Brown, who was part of the team of Schmitz et al., with the famous breast cancer-related lymphedema resistance training. And they concluded that despite the demonstrated efficacy of weightlifting, musculoskeletal injuries and other health problems did occur. Therefore, for the successful translation of this rehabilitative intervention into clinical practice, health and fitness professionals working with breast cancer survivors need the knowledge, skills and abilities that clarify the scope of practice to address these healthcare needs. And I agree with this totally for lower limb lymphedema, for which there's even less research evidence base. So what is the evidence base for yoga and lower limb lymphedema? Well, it's all occurred in Kerala in India, and many of you would have listened if you were at the May Darwin conference to Professor Ryan's wonderful talks about the great work there. And some of you may even have visited this centre. And this is the kind of results they get. So people have lower limb lymphedema from filariasis and are very poor villagers. So they come into their centre for 2 weeks of supervised treatment where their families are also trained, and they're given a home program which they go home and do daily, and they come back for testing approximately 45 and 95 days later. Now they consist of Ayurveda, Western dermatology and yoga. So some of their treatments include an Ayurvedic wash, change diet, dermatology for the skin, Indian manual lymphatic drainage, yoga and compression, and they advise their participants to have limb elevation at night and when sitting. Now this team has a lot of publications, so I drew together some of the pictures. That's the Indian manual lymphatic drainage with the herbal oils and the localized heat treatment, after which compression is added. And the yoga is done both before and then after the Indian manual lymphatic drainage. So they say they've studied over 2,000 people now with lower limb lymphedema, and they found that the lower limb lymphedema swelling is reduced. They've also published a paper where they state that yoga breathing affects the sympathetic nervous system and the parasympathetic nervous system to empty lymph, although they say there's a lack of evidence that breathing actually achieves lymphatic drainage. There's a whole lot of controversy about that. Every time I meet academics, I ask them their opinion, and they're also divided. And the paper I sent you for pre-reading, which you may not have had time, but I encourage you to read it, by Agatayadol, shows that they got improved walking gait, quality of life, and reduced lymph swelling after 6 months of yoga and their integrated treatment. And these are fantastic results. So I thought I'd just show you quickly the rationale for why they do these practices is in that paper for Agataya. Over the years, their practices have changed, but this is the Agataya publication that I sent you has the most recent practices. So they have a warm-up of these postures. If any of you are, this is based on Vivekananda yoga. Yoga names differ, we know, in different traditions. So they do Tadasana 1 and 2, and then triangle, they say, to get them flowing. Then their breathing are really important and really interesting. They do their breathing, which are all heating breaths, at the beginning of their practice. Now they're working with an Indian clientele. Some of these methods, in my 25 years of teaching, I have not taught Australians. We are very conservative with how we teach pranayama or breathing techniques. But interestingly, they use heating techniques at the beginning of the practice. And these are the postures they use, which they say are based on peripheral lymph drainage according to Foldy. They say these sitting postures empty the inguinal and popliteal nodes. And then you'll see that they've got elevation and then relaxation. And their evening, when people are now wearing compression after the Indian manual lymphatic drainage, when they're at home, their family members are giving that. They have a similar warm-up, the same heating breath. This time they add the ankle flexion and extension and rotation, and slightly different postures that are again explained in that paper, that they say the stretching and compression also will empty the lymphatics. And again, elevation and relaxation. So read in your own leisure their rationale for using these postures. So what's my experience? So I put these postures, a friend of mine and I are doing salutes on the beach. This is on the Central Coast in New South Wales. Now the one which is me on the right, I don't give to people. A lot of my students have colostomy bags from bowel cancer, for example, and I don't tend to put them obviously on their tummies. And the kind of lunge on the left that my friend is demonstrating, people with primary lower limb lymphedema find lunging really difficult, but they love this kind of posture where they're on their tummies and bending their knees like that. So I tend to give that instead of lunging. So again, I follow the safety measures that all the research on exercise for breast cancer-related lymphedema has resulted in, which is slow warm-up and slow cool-down, supervised and controlled yoga with plenty of rest, altering the body part. And Singh et al. Have concluded that the jury's still out on compression. I follow the Johansson et al. Conclusion in 2005 that says people can decide for themselves whether they wear compression as long as they put compression on after the yoga session. I still avoid and train my teachers to avoid for yoga any chance of extreme heat or sunburn or cold. Outside yoga is very popular these days, and doing it on the grass or halls where there might be splinters to look out for cuts, abrasions and insect bites. I advise my students not to wear anything too tight, and we change the body parts so repetitive actions aren't in the one area. I train them to hold one position, so one position isn't held for too long until they're able to do it. But always in yoga, and when I train my yoga teachers, I check that the person has medical clearance, the person is getting lymphatic treatment. If they're not, I advise them, and I send them to the NLN, the ALA website. And sometimes when they can't find someone, I've rung or contacted some of you to find if you know someone, and many of you have helped me find a lymphatic therapist for someone, and many of you have helped me find a lymphatic therapist for someone. I always ask the person how they feel in as discreet a way as possible and observe what is happening. And they get to know in their yoga practice what feels right and what feels not quite right. So what is our aim in yoga? Well, the lymphatic system we know looks like this, and the prana system looks like this, and I like to think they're kind of similar. The overall aim in all the ancient texts of yoga is to get prana, or the energy system, flowing, and really it's the same, isn't it, with the lymphatic system. The other overall philosophy of yoga, and this is summarising thousands of years of text, is to optimise internal and external health irrespective of one's condition. That's the beach on Kangaroo Island. So what's our aim in yoga for lymphedema? It's to enable lymph to flow, but not to overtax the lymphatic system. And it's to boost the immune system. There's small studies that's showing that yoga can boost the immune system, and it's been my practical experience that it does. We want to recreate functional and optimal movement patterns, and importantly, increase symmetry, reduce the physical symptoms, reduce stress reactions, and improve quality of life. And, we want to get optimal physical and mental health. So what do we do? In lower limb lymphedema, I include elevation at every point. No matter what time of day or evening the yoga is, people always come in and want to elevate their legs. So we start the slow full yoga breath, then add abdominal contraction with leg elevation, and include a chant to clear the lymphatic system back to the venous system. The postures I do are moving very slowly to pump and clear the lymph to restore kinematic chain of movement, and gradually to recreate stability and posture. I do both forwards and backwards stepping for gait. And the abdominal contractions and twists, I feel people really like them with lower limb lymphedema. I feel it clears the cisterna chyli. I have no proof on that, but it seems to clear something. We then work slowly towards held postures for balance, stability and symmetry. And each series of postures is followed by rest and at some stage leg elevation to drain the lymph during the session. I do the breathing to balance the nervous system and kick in the parasympathetic nervous system towards the end, the exact opposite of the team in Kerala. And do meditation such as witnessing, chanting and visualization, or something focused such as a candle meditation. And again, leg elevation with deep relaxation and ending with a slow full yoga breath and chant to empty the lymphatic system again, to rest and restore. So let's look at a yoga session. So as I said, we start with breathing and leg elevation in whatever way is comfortable. I find those with primary lymphedema would rather be on a soft ball or a chair. To clear the lymphatic duct and thoracic duct back into the venous system, to calm the mind, and to begin to enable the lymph to flow away from the feet. As I said, people come in with very achy legs usually. So we know that slow breathing does create pressure changes, which we believe empties the lymphatic system to the venous system, begins to bring the abdominal lymph to the thoracic area. It also gives mental focus. And when we do the slow breathing with pauses, with the postures, we believe it may aid the emptying. Now, I want to state here that focusing on the breath can be really difficult for people and can bring on anxiety. So sometimes this is achieved with the wonderful technology these days. I might get people to bring in their favourite piece of music, or I might record a little visualization or meditation for them to create the slow, full breath in a different way. We start and then throughout the postures add compression on exhalation during the postures again to create the stronger pressure changes, to empty the lymph back to the venous system, to empty the lymph from abdominal to thoracic area, etc., and to create mental focus. Once we add abdominal contraction, women love it, don't we? We like to imagine we're getting our six packs back. And we commence and finish with a chant. Now, these are two women who've had breast cancer treatment, and I love this photo because you can see how heartily they're chanting. So how do we do the postures? I base the postures on the principles of lymphatic drainage, so by clearing the nodes proximal to distal. They're very slow and rhythmic to follow the slow rhythmic flow of lymph. Then gradually begin to pump the lymph from the distal areas. If I know the person well enough, I will get them to swipe to create alternative pathways, but not always. And throughout the postures, we want to improve symmetry, stability, mobility, gait, and quality of life. So I tend to do slow moving postures, 5 to 7 reps, followed by rest. We work from stable to less stable. So you'll see the top picture there. Those women are doing what we call a warrior posture with support from each other. They've stepped forward. The lady on the lower picture has stepped backwards. So her warrior, she started with moving warriors and can now hold them. And so we do forward and backward stepping, build up to held postures. And as I said, I include elevation at the beginning of the session, during the session, and at the end of the session. So let's have a look at the positions. As I said, I start with supine with elevation, then some postures in a supine position, then go up to a sitting position. It's all gradual, then a standing, and then I do some elevation after standing, and then maybe back to a sitting position, and depending on the person, a prone or supine. As I said, with colostomy bags, I don't put them on their tummies. And ending in supine with elevation, and then a relaxation in supine. So I'll give you an example, as I said, supine with elevation. So we might do some upper body movements and clear the axilla with some shoulder rotations. And then do some abdominal movements, once again, to hopefully clear the lymph from the venous system. And as I said, people with lower limb lymphedema love doing rotations, which I have this belief also clears the system back to the venous system, and I think pumps the cisterna chyli, but I've got no evidence of that. And then clear the inguinals and the popliteals with different moves. And then, if it's appropriate, do some swiping from the inguinals to the axilla. And then do a whole body movement with plantar and dorsiflexion of the ankle. And then have a nice flop. So that might be one line series. That's the kind of way I work. People love flopping, I have to say. So as I've said, in the postures, I include a lot of dorsi and plantar flexion and rotation of the ankles like the team in Kerala. Whether it's lying or standing in different ways, it can be one leg or two legs, as you can see there. Core stability is really important. In yoga, we call these bandha around all the joints. And so again, we might start with partners just holding each other like this and rebuilding that confidence. I find with people who've had a lot of lower lymph nodes out, and we know how many they can be quite worried about everything. And so if it's a yoga class and there's good contact between the students, they can do this kind of partner work, and usually they really like that. They might then, those with lower limb lymphedema, love downward dog with bending and straightening their legs or walking on one spot. And they might eventually start with moving postures like was on the video of the link I sent you, but again, I believe you only got that last night. I was hoping you could have done that session before watching today. And gradually then holding into a chair. Now, a lot of women I see live on farms in the rural area, and they need to get some kind of strength back. So everything I do is really gradual, and I found this really works. And I believe that's partly because we're also working into the fascial system. So it might be lying with plantar and dorsiflexion or rotation with both legs, and then each ankle going a different direction. Then coming into lying just on the spot, and then gradually moving one leg and a little farther away and raising an arm, and then till the whole leg is extended. As I said, rotation I think is good for kinematic movement patterns to re-establish good movement ways. People often rotate from their shoulders, not from their waist. And because people with lower limb lymphedema love it so much and it's working into the abdomen, I kind of have this belief it's emptying the cisterna chyli and hopefully emptying the lymph back to the venous system. And I just put some photos to show you the different types of rotation and how we can support people in them. I include movements that are very flowing, where people don't have to think. And often this is where you get the greatest change in the cool down. And I find this helps functional movements. They can often get more movement when they're not thinking and maybe You know, for example, in Tasmania, they loved imagining they were the deep kelp in the ocean down there. I find this helps functional movements and also works into the fascial lines and fascial trains. Now, people with lower limb lymphedema love salutes to the sun. I presume a lot of you do yoga, so you know what I mean by salutes. And I include the forward and backward stepping. Again, in that little video I sent you, the clip for, there's the first stage where I just got the student to bend the knees and collect energy, then straighten the knees and let the energy flow through her. Then the next stage, so this was someone with a colostomy bag and it had like 38 lymph nodes out from bowel cancer treatment. So we stand, do a little back bend and little forward bend. This is known as a standing cat posture, a strong abdominal contraction. Then do a very simplified version of a warrior, just lifting one toe in the opposite arm. Again, this is good for gait. And then doing that little scooping movement that if you haven't watched the video, you will see that. And then doing the modified warrior, an opposite arm, and the back and forward bend once more. Now the next stage to this, again, the back and forward bend. And this time going into warriors, I should have photographed this sideways. The first one, the front leg is straight, the back leg is on the toe. The second one, both heels are down and the front knee is bent. Then the last picture on the right, the front leg, the heel is lifted. So they're getting a lot of pumping. And then both knees are bent, a little forward bend, then a held warrior. And then you can add rotation here or side bends or anything actually. And then going back to the backward and forward bend. And I've included here one a particular lady on Kangaroo Island loved for her her primary lymphedema. So she could do a fuller back bend and a fuller forward bend. Instead of going into the lunge, she loved her downward dogs with straight legs and bent knees. Now, she could go into that far right child's pose, but a lot of people can't. She likes that. She was only there momentarily, and it does obviously pump the inguinals and popliteals. And then she loved going on to her tummy. I found people with primary lower limb lymphedema love being on their tummy. And that's where she did the pumping on her tummy. And then back to bent knee and straight leg down dog and a stronger forward bend and a lift right up on her toes and back to standing. And so she takes this salute to her class now, still going strong in downtown Kangaroo Island. I always follow the standing postures with elevation to continue to drain the lymph. It might just be held or matched with those lower ones of having a leg in a strap and pointing and flexing the ankle. Now, Philippa in Victoria from melanoma, as I said, people love their salute. She said, I had leg weakness after cancer treatment. The legs kept giving way on me and I had falls. For me, as a result of the falls, strengthening my legs has been a huge thing. The warrior and salute sequences do that for me, which I found really interesting. And Donna, I've changed everyone's names, the student I talked about on Kangaroo Island, said, having a salute that I can do in a class normalises me. And I finally feel as if I'm doing yoga. So some of these people came to me and then I could give them sequences to go back to their usual class because I wasn't staying in the community. That beautiful place is on the Eyre Peninsula that you can see there now, South Australia. So for symmetry and balance, we gradually extend hold. So standing might start like this with, again, a partner. It might lead to standing alone, lifting one leg at a time, or holding this position on their tummy, or perhaps all fours, depending on, I don't do that with everyone with lower limb lymphedema. Or even being supported and then just lifting one leg. I've put mudra in because this is yoga. In India, they say Varuna Mudra, where the thumb is pressing the little pinky fingernail, will get lymph to flow in systems where the lymph isn't flowing. I tend to use this one, Yoni Mudra, because it's about restoring symmetry. So the meditation, as I said earlier, is to slow down the sympathetic nervous system and kick in the parasympathetic nervous system. And there's quite a lot of good research now on the brain and the short and long-term psychosocial emotional effects. I put a few papers there. Now, the posture people with lower limb lymphedema love is called Viparita Karani Mudra, for those of you who do yoga. So the lady on the left is demonstrating the actual posture. The lady on the top right can't hold herself, so has support under her buttocks. Now, this becomes a meditation because they visualize a sun at the tummy and a full moon at the throat center. On the slow full breath in, they follow the breath from the sun at the navel to the moon at the throat center. On the breath out, they breathe out at the throat center from the moon, and then their mind goes back to the sun and they start again. And I find people with lower limb lymphedema love this. It's really interesting. In fact, because they love it so much, I often do it myself now. And then the relaxation at the end with leg elevation, and it need only be a little elevation, I find, but I always use really soft things. I've just demonstrated that with a doona and a pillow. I tend not to use the hard rugs that you can often get in yoga. I use fleecy things, and I like to spoil my students, so I like nice fabrics or encourage them to bring their own. This is from the DVD, the secondary arm lymphedema. Again, we finish with slow, full breathing and a chant to empty the lymphatic system back into the venous system, and of course to have a happy smile to each other. So what's the process I follow with those at risk of secondary lymphedema? From diagnosis now, I give them a session to prepare the tissue, a physical session, and people will do it 2 to 3 times a day before surgery. For those having breast cancer treatment, I ask them to get the DVD from ALA and do the first session but without the swiping. I teach them in personalised breathing practices and mental practices, and if they're not already referred to a lymph therapist or physiotherapist, I make sure they know who their closest one is. Often in the private systems, we know people don't get physio. After surgery, of course, they can continue with their own recordings of their breathing and mental practices, and perhaps if the physio is okay to do some gentle upper body movements. After medical clearance, I start the slow progression of yoga, which people are dying to do because it's giving them power back to help themselves, but with individual variation. Often lymphedema isn't the only problem people have, as we know, and always get feedback. I always insist they're also getting lymphedema therapy. With primary lymphedema, I check their treatment history. I work with the person to create or change postures so that they can go back to their own class if it's not one of my classes, and have alternatives. And they will do this quite happily. For all of them, I give some short practices they can do at work or after driving or flying, or if they're going on holiday. So that standing cat is one of them, the little back bend and the strong abdominal contraction. Heather, this is a beloved student of ours we had in Hobart when I lived there. I work with a lot of palliative people, and so I was really interested in going to a lot of those sessions at the conference in May. And I believe, Heather, this is some of your very beautiful kinesiotaping. So The mental practices from yoga are wonderful, such as the relaxation, visualization, mantra repetition, which changes the brainwave from the limbic system to the prefrontal cortex. People like to visualize, especially if they've done a lot of yoga, the visualization of the physical practices. If it's possible, they still like to coordinate their breath and very gentle physical practices. It depends on their stage. But always I'm working in conjunction with the medical team, especially the lymph therapists and physios. So basically in yoga with lower limb lymphedema, I stick to this Shira Sukham Asanam, one of the Yoga Sutra from Patanjali, which means slowly and steadily. So my student Sue, whose little sequence I did send you the link for, so you can try that for yourself. She said, this is another beach in Kangaroo Island, doing yoga after my surgery gave me a focus to bring control back into my life and refine my body and self in a gentle yet effective way. I did the practice 3 times daily for months, as well as going to the class and doing a gentle practice just for me. I loved it, and it brought me back to being positive about my life, as well as slowly mixing with other people again. And she's still going. I think I left Kangaroo Island in early 2015, and I was able to train the yoga teacher and give the lymphedema therapist and not the rural nurses there, a little session. And she's still doing that yoga to her very great credit. So future directions, we all know research is needed for lower limb lymphedema. I get asked constantly to make a DVD for lower limb lymphedema. I've been looking into that. Once again, I need to get funding for that. I will continue to train yoga teachers face-to-face and online because of the precautions that I think people need to make. I am giving a face-to-face session in Melbourne on the 29th and 30th of April. If any of you do go to yoga and would like your yoga teachers to come to that training so that you can work with them, please get them to contact me. The interest among yoga teachers, I have to say, isn't high, but I always get 7 to 10 from all over Australia. This one will be in Melbourne. I've had them in Sydney and Perth. And wherever I have them, they come from all over Australia, and they continue to do really great work. And as I said, the teacher in Canada is doing fantastic work. So that concludes my presentation. There's billions of the references I've referred to and the websites for your interest. And I think I hand over to answer some questions now.
Thanks, Annette. That was absolutely wonderful and very comprehensive. Absolutely wonderful and very comprehensive. There's a question from Bernadette asking what formal training do you recommend to be able to teach our clients these routines?
Yoga therapy training. It's in the same way, although I've worked with physios and osteos for 25 years, I'm not a physio or osteo, so I refer people. So Bernadette, if you work with or if you go to yoga, encourage your yoga teacher to come and do this, my training. I'm not saying that for me to get more students. I'm just really passionate about people getting this. I get emails from people with lower limb lymphedema every week saying they can't find a yoga teacher who'll have them. So yeah, the sessions I have on the videos, we have lots of precautions on that. The upper limb lymphedema, I often get people to buy that. but with the proviso that they are getting lymphatic treatment too. So I hope that answers your question, Bernadette.
Katrina asks, are there some types of yoga that may not be so good for people with lymphedema, Bikram yoga, etc.?
I've never referred people to hot yoga. I've had people come to me and say, I want to go back to my hot yoga. Can you make a set of sequences I can do? And because the jury's still out on the heat, I say, no, it's against my duty of care. However, I've had women who haven't got lymphedema, but who have trialled heat yoga, who were yoga teachers of heat yoga, and they've found doing one session a day, but these were yoga teachers who did that prior to their treatment. It helped them reduce the aches and pains they get from hormone treatment. And just this week, one of those yoga teachers contacted me, and she said now she just goes to infrared heating and she can't do as much as she used to. She's had 2 bouts of breast cancer. She doesn't have breast cancer-related lymphedema, but she's had fairly major surgery. So I personally always adhere to caution. Other people may not, but yeah, you know, when I started, lymphedema therapists wouldn't even talk to me in the 90s in Sydney because they thought I was way out there with yoga, and I actually did my own lymphedema training, so I knew what I was doing. And now the tide has changed, as we know, and I'd suggest most of you probably do yoga. I can't believe how popular it is myself. But I started very cautiously, and I still adhere to caution.
Thanks. Genevieve asks, do you need to be a yoga teacher to do your online course?
No, you don't. Because you'll see the principles that I use, and you may then be able to work with a yoga teacher and show them the principles. I know that's happened in the past with a teacher in Melbourne that she came and did my training, and we couldn't find a yoga teacher to work with her, but she could then find a yoga teacher to teach the principles too. I know that sounds strange, but in some rural areas, I mean, to be true to my profession, it should be a yoga teacher doing this, but if there's not one around, and you know, we can make a DVD of the lower limb, you're the next best person to give the advice to.
Well, let's hope that you can manage to make a DVD for the lower limb. That would be wonderful. We're way over time, so thanks everybody, and thank you, Annette. That was great.
Oh, that's a pleasure. Bye, everyone.
Thank you, Annette, for your presentation, and thank you to everyone for attending today's webinar. Please stay logged in to take our online survey, which you'll be redirected to now. We thank you in advance for your feedback and wish you a pleasant afternoon.